Hi Staff Advocates, it's Soren Schnell with the Community Clinic Consortium. I just have a couple of updates on national healthcare reform, which is always the topic I come to you with. The first is that this week, Thursday the 25th of February, President Obama, as many of you probably have read, is hosting a bipartisan healthcare summit at the White House. This is really sort of a last-ditch attempt to see whether any sort of agreement between Democrats and Republicans can be put together, and the idea is that while there's been a lot of attention on what the Democrat plan has been, there hasn't been a lot of real attention to a comprehensive plan by the Republicans. And so the President has requested that Republicans come with a plan like that to the summit on Thursday, and to see whether there can be sort of an agreement hammered out between the sides. And in advance of that, the President has put together his own compromise plan, which is sort of a blending of major provisions of the Senate and the House bills. As you'll remember, both the Senate and the House have passed their own versions of healthcare reform, but they won't agree on each other's versions. So until they do that, nothing can get to the President. So the President's trying to take more of a leadership position here, take some of the best ideas from both bills, put them into one proposal, and then hopefully have Congress pass those to him. Again, if there's no real movement that comes out of this bipartisan forum, no real Republican additions to the plan, then the idea would be that the Obama compromise would need to be done in a way that can be rammed through the legislative process with only 50 votes in the Senate and not the 60 votes that the other bills needed. And that's sort of a topic for another update, but the idea being that what Obama has in his back pocket is something that Democrats would be able to pass really without independents and without Republicans. So the second news update is that many of your CEOs will be going up to Washington, D.C. this week. I'll be accompanying them on visits that they make to Capitol Hill in Washington, D.C. So Cheryl Johnson, Jane Garcia, and Mike Kirkpatrick are all going up. And what's exciting about this is that we in part get to deliver some of the postcards that came out of the postcard campaign that you as staff advocates all helped with, which is fantastic. I get to hand these to Jane and to Mike and to Cheryl and have them pass them on to the members of Congress, really sort of as a physical reminder of the support that community clinics have for healthcare reform. So I just wanted to say thank you to all staff advocates and all staff in general who helped make this postcard campaign a reality. We've got scores and scores of these signed by patients and staff of your clinics saying that the time is now in 2010 to pass healthcare reform and really get the ball rolling again. There were some of you who wanted to be part of the postcard campaign and I wasn't able to make it out to your clinic sites, and I really apologize about that. I just couldn't get my act together to get out to every site. There will be plenty of advocacy opportunities coming up though, so don't give up hope. I'm sure that I will be out asking for your support on things like this, possibly around the state budget, possibly around local county budgets, and possibly around national healthcare reform. So anyway, as always, stay tuned, and if you have any questions, please hit me back by email or phone, and yeah, hope all is well.